Senate leaders now have a choice: try and rewrite that specific Medicaid provision or leave it out altogether. Make no mistake, the expectation is that there will be cuts to Medicaid in the final version of this legislation, but experts warn any cuts to the social program could devastate rural health care. As Republicans in D.C. negotiate Medicaid cuts, Greg York in Coffeyville, Kansas fears the result.
What's at stake is just everything. All we do is dependent upon those dollars.
York works at an independent living center, and he worries Medicaid cuts could shut them down.
If we can't provide those self-directed home and community-based services, then a lot of things go away.
The debate comes at a perilous time for rural health care. Nationwide, 1 in 3 rural hospitals have some risk of closing, according to the Center for Health Care Quality and Payment Reform. More than 300 face immediate danger.
Even in the best financial situations, rural hospitals are deeply dependent on Medicaid funding for survival.
Medicaid cuts have been one of the biggest sticking points among Republicans.
I think we have got to protect rural hospitals here as part of this bill. I just talked to the president about this last night. He completely agrees.
Others argue the cuts are needed to reduce the deficit and partially pay for the tax cuts in the big beautiful bill.
We're making some common sense reforms to Medicaid to eliminate waste, fraud, and abuse.
But York says the rhetoric in Washington is not what he sees on the ground in Kansas.
It's difficult for me to believe in my mind that there's that much fraud, waste, and abuse.
One possible fix that has been proposed: a $15 billion stabilization fund sent to states over the next 5 years, specifically for rural hospitals. Some Republicans have said that price tag is too steep, while others say it's not enough to fix the problem. On Capitol Hill, I'm Christopher Salas.